This very short modules to talk about care of the transgender patient. Prior to review of care of transgender patient, I think it's very important that we as nurses sort of understand the new and evolving terms regarding transgender. So there's a great new documentary that was done by CBS last year that looks at gender identity terms. So if you're not familiar with those, be really important to do that. The first one's essentially 2 minutes long, which is a nice brief overview. And then the second one's actual reflections of people that are transgender and how they identify. And I think it's really important to see it from their perspective. So, in treating someone, this is a very unique population because they identify differently. It's important to understand the terms that are used and that no patient is exactly the same. So, it's really important to treat them individually and understand where they're coming from. There are nursing care guidelines for the care of the transgender patient. Um, it's really very important to know that each transgender patient will have therapy, um, that they designate with their health care provider. And not all transgender patients want to take hormones or want to change their bodies in the same way. So it's very individualized. So in looking at hormone treatment, you'll have cross-sex hormones, so estrogens in male-bodied people and androgens in female-bodied people. This is generally the most common body modification that transgender patients use to make themselves different than their birth sex. Hormones generally bring their endocrine and psychological systems into balance. This has been something that patients have expressed over and over again. And like I mentioned before, not all transgender people want to take hormones. And not all transgender people want to take hormones to change their bodies in the same way. So, in looking at hormone treatment, there's going to be maximum expression and alternative expression. So, with maximum expression with female to male, you increase testosterone levels to a typical male physiologic range by administering testosterone. And for male to female, you want to decrease testosterone levels and to a typical female range by giving an anti-androgen and an estrogen. And with alternative expressions, the goal for hormone therapy for some transgender and gender nonconforming people might be to express an androgynous identity. Care of these patients is rather unique and requires a lot of monitoring for these patients. It's very individual. So if they're undergoing hormone treatment, it's always important to have a baseline. The prescribing provider should monitor the patient for male or female effects and then adverse effects every 3 months for the first year and then every 6 to 12 months. Additionally, regimes will differ. So those transgender men or those female to male, you'll be looking for things like their serum testosterone. You can do a trough just before they get an injection, and then you can check their peak level 24 hours after they're injected. Additionally, because of the effects of testosterone, you're going to be looking for hematocrit, lipid profiles before starting the hormones, and on follow-up, you're going to look at bone mineral density as well as any other physical effects. For those patients that are female to male, You're going to be looking for baseline data just as you would with the other population, and you're going to be looking for serum testosterone, estradiol with follow-up visits, and then looking for the target in the female range. Other things you're going to look at are prolactin and triglyceride levels at the beginning and follow-up visits. These patients are generally on spironolactone, which is a potassium-sparing diuretic, so you'll be monitoring potassium levels and also looking for osteoporosis. Both of these sets of patients, you're going to look for adverse effects. For instance, male to female patients, you'd screen for breast and prostate cancer appropriately. Hormones can be self-administered orally. Some things are parenteral or transdermally. For instance, like testosterone can be injected. And transgender adolescents usually have stable gender identities and can be given drugs to suppress puberty until they can proceed with hormone therapy as early as age 16. So nursing management of these patients are very unique. It's individualized. You're going to monitor their baseline, and then every 3 months for the first year and every 6 months thereafter, know their hormone therapy and adverse effects based on the hormones that they're receiving. And for additional guidelines, feel free to take a look at our resources via UCSF. I hope this was helpful, and I have additional references listed.